This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and Happy New Year.
Happy New Year, John, and to all.
We know that you missed us, and hopefully you've made a New Year's resolution to get healthy. So you've come to the right place.
Hopefully that is true.
Health Watch is the program, the first one of the new year, and we are here every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly FANTASIA is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I'm your host, John DeMasi. We are pleased to be here for the first show of 2023, and we're going to talk about what exactly does Innovative Medical Associates do and how it can help you and your family improve your overall quality of life. 855-839-1210 is our number here in the studio. 855-839-1210. If you have a question or you have a medical challenge that you want to run by Dr. Molly, well, that's what you do. You call that number, 855-839-1210. Dr. Molly, it's a new year, but we're going to continue to do what we do all the time.
Of course. And hopefully people have made their New Year's resolutions that include their health, and it's really an important part of life. It's what keeps us going, our vitality, John.
Yes. So what do you do at Innovative Medical? Let's start with where we left off.
Okay.
What do you do?
Okay. Innovative Medical Associates is a cooperative of like-minded practitioners who actually all work out of our licensed primary care facility in Marlton, New Jersey. And we've been doing this, John, in October for 26 years. 26 years, John. So we can do anything that a normal primary care facility can do. For example, think of us like as a convenient care, not necessarily urgent care, but a convenient care. You go in, your old-time primary care doc. You need an antibiotic, he prescribed an antibiotic. You need some x-rays, he prescribed some x-rays. We can do all of that and more. But the real key difference is that we are like-minded in we want to use the least amount of pharmaceutical to effectuate the change, keep you medically safe. For example, if you have hypertension and you need a hypertension pharmaceutical, well, of course, our doctors can prescribe that. But the idea is we want to reduce the side effects of these particular drugs. And how do we do that? We do that with God's ingredients or natural substances, vitamins, minerals, amino acids that you can usually find at a health food store.
So what you do is that you substitute or
we augment.
Augment is a better word, yes. That you augment the hydration.
Well, we didn't even get to the hydration.
But you would get, yes. It yes. Sort of takes the place of.
That's right. It can help a patient achieve their medical goals. And why we use hydration? Hydration seems to be the best vehicle to deliver these natural products and deliver them safely and in conjunction with traditional meds. If you need them, we can actually deliver some traditional meds, and it's done every day in emergency rooms and urgent cares through hydration because it's the most effective way. We bypass the digestive tract where we lose some of the product, some of the constituent that actually effectuates the change. So there it is in a nutshell. The hydration is the vehicle by which we use to get these natural products into a patient and hopefully help your traditional meds or even get you off of some traditional meds, effectuate the change, and allow you to have a quality of life.
Okay, why other than bypassing the digestive system? Why is hydration effective?
Quicker, more effective. It can go right to the area we need to do the effectuation. So there's lots of reasons to do this. The idea is you want to do it safely, which is why we're not a spa. We are a medical hydration clinic.
And that's really
a huge
difference.
Right.
And you see all these spa things popping up all over the place. And
you know, you said something beautiful. Do you know that I had a patient who came in to see me this week who has cancer? I want you to hear this, guys. He has cancer, and he's going to a very, very fine physician who I actually know of, and he has a reputation. He was getting, quote-unquote, vitamin C therapy for his cancer there. But you know what? The doctor only delivered the vitamin C once a week. Well, let me tell you something. I have a cancer protocol, and you know this. John.
Yes.
When I'm in the throes of it, you may have to come in every day or at least 3 times a week to do this. And I couldn't even believe it. I just couldn't believe it. And then he said to me, well, I'd like to come because the doctor referred him to me, to you, and then go back to the doctor once a week. I said, geez, I would love to help you, but I really can't. And he said, I don't understand. I said, your doctor will understand when you go back. I can't mix it up. I'm not going to do that. We have a protocol. I've developed the particular protocol with some additions that the doctor isn't using, and I'm not going to do that. I won't put a patient at risk.
So that your protocols are
more
intense, yes.
Yeah, more extensive in many cases. Yes.
So what they're giving there is not what you're giving.
No, but I'm saying the doctor is a fine guy, but he's not equipped. Listen, my undertaking, 26 years, this is a big undertaking what I did, and still is today.
Yes, I know that. But let's say, I mean, where does this... how can I put this?
Sure, put it any way you want. Give it to me, John.
How does this work? I mean, do you come in once a week? Do you come in twice a week?
It really depends. We just got off track about the cancer patient because what we were talking about was the spas. You know, well, to me, what the doc was doing is he's trying to do a good job, but he's not equipped to really put together a hydration clinic in his primary care practice. And that's understandable. What I'm saying is particular protocols have to be given more than once a week or once every other week or once when the nurse gets around to it. I mean, you just can't run something like that. This is a true medical hydration clinic primary care, meaning we want to effectuate the change that's going to help the patient medically. That's what we do.
And that's all you do?
Well, it's not all
so
we do. I mean,
let's talk about that.
We talk about nutrition. We talk about other things. And if you need medication, we're going to give it to you.
Yes.
So the bottom line is this. What we are medically supervised, and it's not just that we have a medical director, but we actually have registered nurses on staff, and we then do, for example, I'm going to give another example. We actually did an iron infusion this week for someone who needed this to deliver her child. Now, we got the referral from an OBGYN doctor. Why did she choose to send them to me? Because she knew I was equipped to handle the patient who was pregnant and was, if there was an issue or a problem, and also knew enough about how to deliver the iron so that we can bring it up just enough without over ironing her, so to speak, you know. I mean, we have to look at these things. So again, it's a matter of, do we focus on some things that, let's say, that spas, etc., people who do this part-time don't? Of course. And I want to thank my staff, my medical staff in particular. You know, I have a retired anesthesiology on the staff. She's a huge help. That's besides the family practice doc.
Yes. So you have a variety of staff that can handle pretty much anything.
Right, exactly. And that's what we want to do. Obviously, if you need a little PT, we have a part-time PT person. But the other thing is, for example, I'm looking at how do we help our patient in the long run. But I have to say that hydration is the cornerstone of what we do. That's how I would put the hydration.
And hydration can be once a week, twice a week. It could be every day.
It depends on what you're coming in for and how quickly do we need to arrest the problem.
But the average person, what could they expect?
Once a week, and probably they start to see changes in as short as 5 weeks, John.
5 weeks?
Pretty good.
That is pretty good.
Better than some medications.
Yes,
Okay.
that's for sure. Yeah. We are coming up on our first break of the morning, and our show is called Health Watch. It's here every Sunday, 8 till 9, here on Talk Radio 1210 WPHD. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. The number here in the studio, 855-839-1210. 855-839-1210. We know that you've had a lot of issues maybe have come up over the holidays, so we're here for our first show of 2023. 855-839-1210 is the number. You got a medical challenge you want to run by Dr. Molly, you have a simple question, then feel free to call in 855-839-1210 with Dr. Molly Fantasia. I'm your host, John DeMasi. We're coming back with more of today's Health Watch after these words. We are back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates, and the number is 856-489-0505, 856-489-0505. That's the number. And when you call, it's simple. All you have to do is set up an appointment to initially consult with Dr. Molly, and that is complimentary, and you'll find out a lot about the clinic and about what she does and about how it can help you improve your quality of life. 856-489-0505. Set it up, and you'll be on your way to better health. And, of course, the website, innovativemedicalassociates.com, innovativemedicalassociates.com is the website. Check that out as well. A lot of good information on there as well. It's Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. And if you want to contact us right now, 855-839-1210. You said something very interesting before the show to me, Dr. Molly, and you said, why not cancer prevention?
Yeah,
and that led me to believe that you have a protocol to prevent cancer?
Well, here's the thing, John. It's very interesting. It's usually not difficult to getting rid of cancer because many times if you get in soon enough, what happens is they remove the tumors. A good example of that is like the colonoscopy or the pre-tumors. So, for example, the hard part is keeping it going. And one of the things you've heard me say throughout the years that we've done this is you don't get cancer the day they find the growth, right?
Yes.
You don't get it.
Yes.
And we all know about removing the polyps. Well, what are polyps? They're tiny growths. Now, I'm not just talking about colon rectal cancer. I'm talking about this traditionally. So one of the things I started thinking about is, sure, I have a great cancer supportive program for people who choose to do additional treatments after the surgery to get rid of the cancer. In other words, to be sure they're rid of the cancer. At least that's what their oncologists tell them. So, but it's my experience that generally these cancers are pretty smart. And what happens is that maybe 8 years, as you know, like people say, oh, I'm 5 years cancer-free. I'm 10 years cancer-free. Yeah, you may be. And then it came back. Why? That's what I'm talking about, that type of problem. So one of the things I looked at was, yes, I had a patient or potential patient who came in right before the holidays who said, I had no cancer. My breast cancer was completely gone for 7.5 years. I don't know why it came back. Well, let's start with looking at that. Well, we have a genetic reason for it. Yeah, you do. You have genes. And we all know, though, we don't have to live and die by our genes, do we, John?
No.
No. Because how come people who never had a history of cancer get cancer?
Yes.
Right? And they don't have any genes for it. And then we do the tumor protocols. So we say, oh, well, you have a BRCA gene or you have this. But how about the people that have those genes and never get the cancer? What's the difference? The difference is lifestyle. The difference is their epigenetics, and your epigenetics are just as important as your genetics. In other words, when we're looking at maintaining a lifestyle, we have to look at why does your body tend to make cancer? Well, one of the things we know is what? The stresses of everyday life. One of the things I can tell you is that, you know how many people I see who come to the clinic who eat on the run? Do you know what I mean by
Probably
that?
a lot of people.
Yeah, they eat in their car. I never
Yeah.
saw anything like
Yeah.
it. And what are we eating when we're eating in the car? Fast
Junk.
foods and junk and everything else. So we have a protocol to help people reduce their metabolic stress, improve their overall health. And this includes utilizing anti-inflammatories that are extracted from food-based plants. For example, things like curcumin, very important anti-inflammatory. Proper hydration is another thing that can help prevent cancer from coming back. Balance your hormones. One of the things we do for any of our patients who come in who say that they've had a bout of cancer. Let's take prostate cancer, for instance. One of the things we might run is not just the PSA, and we say, oh, your PSA is normal now that they took the prostate out. But you got to watch that, don't you? Have
Yes.
you noticed?
Yes.
How many times have you gone back to your urologist, and even though your prostate is out, gentlemen, your PSA is going up? Why is that? Because of proteins. We've got to what? We've got to look at those and say, what's causing that? How about we run some hormonal levels on all our patients, both men and women? Do you realize that a 55-year-old man and a 55-year-old woman, this is so interesting. The man's estrogen is going up and the woman's is going down, right?
Yes.
Menopause. But estrogen is a big culprit both for men and women in terms of cancer because it promotes growth. So these are the things we're looking at. So what would we do? We would use some natural anti-hormonal types of products in your IV. So these are the things that we would look at, and we would look things that are aromatase in nature for men and for women.
Let's pick that up in a moment. Okay, we have a call.
Okay.
Let's go to Joe. Joe in Germantown. Good morning. You're on Health Watch. You're on with Dr. Molly.
Hi, Joe.
Good morning, Dr. Molly. Good morning, John. Happy New Year to you both.
Happy
long
New Year.
time no talk to.
That's right.
I listen every week with Phil. I listen to the tape shows and stuff because I'm a dedicated listener.
Oh, you're a good man. Thank you.
You're welcome.
I'm honored. That's a privilege to know you, Joe.
My pleasure to likewise, Dr. Molly and John. You know, we're supposed to be rational people in this country. This country's supposed to be built on a country of dissent, disagreement, we have respectful disagreements without being disagreeable. In other words, we could disagree politically, we could disagree on something else, but we still can respect and care about each other. But it just seems to me, Dr. Molly and John, that anybody that say that they not down with the vaccine, they get treated. For example, I watch a lot of media outlets, and so I know it's some of the doctors, even doctors that not necessarily naturopathic, but they have an MD next to their name, when they even question the vaccine and say maybe ivermectin or some other things could be effective, they get shouted down. They get accused of being an anti-vaxxer, a conspiracy theorist. Like, for example, this young football player that had that incident this past Monday.
Oh, my God.
Yes.
A medical person who I have a lot of respect for, they told one of the media out, when they told one of the doctors that was pro-vaccine, they said, is it possible? They said, because from what I heard, the young man has been vaccinated. He got the boost. They said, is it possible that his vaccination could have had something to do with his heart? He said, and the guy, and the doctor, he was placed. I didn't say it was. He said, but is it possible? Why he want to say that for? He got shouted down. Now this man is a respected doctor, MD next to his name, because he had a difference of opinion. And I'm saying to myself, if y'all so sure about the vaccine, it's so perfect, and so well, then why do y'all not want to have heard any kind of dissent? I mean, if I stand on my belief system, I don't care what nobody say. I can deal with any kind of dissent because I know what I'm saying is true. But if all these pro-vaccine people, if they so sure that the vaccine is 100% foolproof and they don't have no kind of side effect, it don't cause no possible death or whatever, then why do y'all attack so virulently people that say that they take an alternative and stuff, whether it be ivermectin, whether it be any other kind of things that they take, and vitamin C, whatever. If y'all so sure about the vaccine, then why do you attack others who have a different viewpoint? And it just seems to be, Dr. Marlin-John, anybody that said they don't take they didn't get the shot, but yet they still healthy, they never got COVID, but when people that they have got COVID, the vaccine vaccine and the boosters, and they got sick, and unfortunately some people may have died. When they put those things out, they shouted down, "Oh, you just a conspiracy theorist." You know, I mean, all this crazy stuff going on, man. I think the
it is crazy, Joe, and thanks a lot for the call, Joe. We appreciate your input.
Let me tell you, his input is really, really cool. Let me just say this. As you know, I have MD, DO physicians. I have people who work with me who are RNs. I have a PhD in science. And you and I know that it's a problem. You know, it used to be that it respected medical opinion, but there are some things conventionally, my friend, we just don't allow any opinions other than what is the legislative body or the administrative body's opinion, because they can yank people's licenses.
Yes.
So thank you, Joe.
Yes. 855-839-1210. That's our number here in the studio. Dr. Molly, you said something about epigenes. Epigenetics. What is that?
That's the outside influences on your genes that cause them to turn on and off. That's why I talked about things like the eating. That's why I'm talking about reducing metabolic stress. That's why I'm saying toxins. You know how many toxins we get? All of these things in our food, all of these various proteins that are put in our food that are a problem for the body to digest, not just the natural, not just nature's proteins. The other thing we need to do for prevention, or to help at least slow down the progression of cancer, is to improve circulation and also of oxygen and nutrients, because there is a lot of data that dates back to the early 1900s showing that cancer cells can't survive in an oxygenated environment. So we want to look at that kind of thing. Also, we want to look at reducing our sugar intake. Very important. That's why my cancer supportive therapies and my cancer prevention therapies include certain types of extracts of vitamin C that have less sugar in them than, let's say, getting it from citrus fruit, so to speak.
Okay.
Got it?
Yeah. You know, interesting that you mentioned sugar, because right before my stroke, I was a bad boy. I was not checking my sugars, and, you know, I was eating cookies, cake, you know, that kind of thing. And so we had the stroke, and you said pretty much you attributed that to excess sugar.
Right, because I attributed that, and my doctors attributed that to the fact that the diabetes was out of control.
Yes.
Silently out of control. That's a big molecule. We've spoken about that before, and pushing that around in the circulatory system is something. You know, John, also, I think it's really important to continue things like your lymphatic system. You and I have spoken about this ad nauseum. I've said the lymphatics are very important. It's a closed system that helps detox the body. Very, very important. I look at heavy metals for my people who have cancer. I look for viruses. How about people who come into me and say, I have fibromyalgia, I have chronic fatigue, I'm positive for HHSV1, which gives us the cold sores, that kind of thing. And their doctor said, well, don't worry about that. Well, guess what? Dr. Molly does worry about that, because the body's always fighting those viruses, even if they're at a low level. So, you know, the body can only do so much, John. It's a wonderful machine God's given us, but we have to take care of it.
Okay, we'll pick that up. We're coming up on our halfway point of the show. We will pick up that discussion and others right after the break. It is Health Watch, Sundays, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. I'm your host, John DeMasi. We are coming back. 855-839-1210 is our number here in the studio, 855-839-1210. We're coming back with more of today's edition of Health Watch right after these words. And we are back here on Health Watch. Operators are standing by right now at Innovative Medical Associates, 856-489-0505. if you're bashful and you don't want to come on the radio, you can talk to the operators because they'll answer your questions. And really, why you're calling there, or what you would call there for, is to set up an appointment for the initial consultation with Dr. Molly, and that is complimentary. And, at that point, you'll go over what she can do for you, and so on and so forth. And that's really what you want to do. Take that initial consultation. 856-489-0505 is the number. 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Health Watch is the show, Sundays 8 till 9 here on Talk Radio 1210 WPHT. We have one of our regular callers, and we're welcoming him for the new year, Frank in the Northeast. Frank, good morning.
Hi,
You're
Frank.
on with Dr. Molly.
Hi, Frank. How are you?
Good morning, John. Good morning, Dr. Molly. Happy New Year.
To you, too, my friend.
And you off the last two. What's that? Oh, yeah, healthy one.
Yes.
I started off not healthy. I'm sick already again. That IV antibiotic killed my gut biome. Anyway, Dr. Molly, have you ever heard of Humvic acid? It's spelled HUMVIC.
No, John. No, I didn't. Tell me about it.
I don't know too much about it. I heard it last week on a radio program, but it was a bad reception. I was asking Alexa, and she tells me different things. The one thing Alexa told me was in 2013, the FDA approved it for different things like autoimmune diseases and also degenerative eye diseases. I asked her more. She said with macular degeneration and retinitis pigmentosa.
Okay.
But I mean, I never heard of it myself.
It's a drug. It's a drug, right?
It's a supplement. It's over the counter, yes.
It's over the counter. It's not a drug. I'll check it
Well,
out.
actually, I'm not sure. I think it's over the counter. I'm not certain. I'm trying to find information about it. I called up Holly Hill Vitamins, and he's looking into it himself.
Yeah, I love him. Okay, he's a good guy. Well, I will look into it, but I really don't know, Frank. I know that there are some things that have just come out. Now, I wouldn't be surprised if it isn't a peptide, which I was going to get into a little bit today, but I wouldn't be surprised because there's a bunch of new peptides that have come out that finally the FDA is approving ever since the drug companies can make a drug out of it. You know what I mean? So it could be an extract that has peptides in it. So I'll look at it, Frank. I will over this week coming up.
Yeah, Frank, and we'll keep you posted on that. Yeah.
I always appreciate.
Thanks for the call.
Thanks for the call, and I always appreciate when a listener gives me something else to look up or to know about. And Frank's pretty knowledgeable.
Like you don't have nothing else to do.
Oh, that's all right. That's okay.
I mean, you have a few things to do during the week.
You know what? It's always good to know what's out there and what other people are promoting. Some of it good, some of it bad. And the idea is most of it's right in the middle. John, we were talking about the cancer and the cancer. Cancer's ominous because it becomes life-threatening when it spreads. That's my point about if you've been diagnosed and you believe you're cancer-free, you should still come in for a consult. It's very interesting to help you maintain the status of cancer-free because I had a patient who ended up having a discovery of a 2-centimeter tumor on the pancreas, but that was all. She never had it spread. So what happened? I asked, well, what did you do? Of course I had it out. They actually took the tumor out. And the surgeon said, well, don't worry about it. We caught it in time. All right, that's great. I'm glad to hear that. And I will always tell people I love them to get the beast out. Get it out.
Yes.
You'll hear me say that. When you need surgery, you need surgery. But she's been cancer-free, I think, for 5.5 years, 6 years. How did she do it? Well, she started to have a very strict diet. And then she started to read that hydration therapy was able to deliver certain nutraceuticals that could augment that anti-cancerous diet. And again, I'm going to tell people, conventionally, you go into any oncology unit and you get your IV for your oncology drug, you'd be shocked to see how many candy bowls are out there.
Yeah,
right?
That's right.
Have you heard my patients
Yes,
talk about that?
yes.
Well, that isn't a good pillar to have out there for the cancer patients because, again, we want to limit your sugar. We want to keep control of that insulin. We want to look at that, and that includes both working on the epigenetics, which means in terms of your insulin, and also keeping your diet to have a low glucose diet. Very important.
We have a phone call. Rich is in Cape May. Rich, good morning. You're
Hi,
on
Rich.
Health Watch with Dr. Molly.
Hi, Rich.
Yeah, good morning. Hi.
Hey, Rich.
It's nice to
This
be
is
on.
my
Hi.
favorite, Rich. This is Rich, who's married to one of my favorite nurses.
And the owner of our therapy dog, one of our therapy
yes.
dogs.
And you know what? He's a lucky man. He's a lucky man.
I am a lucky man in all ways, and especially to have you, Dr. Molly.
Stop.
There are, I wonder sometimes I come in for a treatment, and I wonder how much it helps. Well, I got to tell you, I couldn't come in the past week because I've been diagnosed with Parkinson's and all kinds of stuff. And boy, I got to tell you, I miss it. For first thing, a lot of my pain has come back. Yeah. I've had to take some anti-inflammatories, and I will definitely be in next week. And the last time you gave me something, and it's so important with Parkinson's, is to help clear my brain.
Exactly.
Because I know my brain has a lack of dopamine, and
yes.
really be a mess.
And you know what, Rich? I applaud you for taking the Parkinson drug that works on this. And, we can enhance the action of that. See, here's the thing. As you know, I have several Parkinson's patients, including one of my medical director's brothers. You ought to see how good he's doing. And he's on the same drug that you are. An oldie, but a goodie, as they like to say. And, Rich, there are things we can do to help that and help a Parkinson's patient, stop some of the tremors, improve mood, which is so important in this thing. And because remember, your mood is all biological in that it's biochemical. We want you to be happy. You still sound pretty good, Rich. So I'm thrilled you're coming in. And I think I tried to follow up with you to get you to come in last week, but I knew you were busy. So, definitely I'll look forward to seeing you this week. Okay?
Yes, and thank you for all you do, and I definitely will be there this week.
Okay.
And bring your dog.
And don't forget to bring Lucky.
Thanks for the call,
and
Rich.
God bless you, Rich. And give my best to Lana. All right.
855-839-1210 is our number here in the studio. We want to get into peptides because you mentioned it, and we'll get into it a little bit, and then we'll break and come back and talk more about it. So, but what did you want to talk about with regards to peptides?
Peptides in that, they are smaller chains of proteins, so they're not amino acids. They're smaller than the amino acids. But they really are very, very important. And as I said earlier, that finally peptides have been certain approval. There's been certain approval from the FDA for integrative physicians, et cetera, to get some of these peptides. And I can tell you that it's very, very important. We use peptides in our practice, and I've been using them for a very long time. And they serve a purpose because they're very good, as I was saying, in particular for certain neurodegenerative diseases like MS and what Rich called about Parkinson's. And it's the idea is you want to use peptides in a way that augment some of the other things you use in the IVs. And I think that we do a good job. And as a matter of fact, I had a young man come in this week who had PRP somewhere else. And he said, Dr. Molly, I came back to you because the last time I had PRP, it was with you. And I said, yes. He said, but you followed that with some peptides. And the PRP I had with you in that particular region tended to feel better longer than what I just did. So he came back to have the peptides, and I said, well, I don't like to do somebody else's work, but okay, because I know the guy. But anyway, the point is they can help with growth factors, and they can also help in multiple pathways so that they've been targeted, for example, for certain cancers. In the new drugs, the immunotherapies that are coming out have peptides. But the way we use the peptides in our practice is with the natural substances.
Okay, we're going to pick up more of that and other things. And again, we are Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is our number here in the studio, 855-839-1210. We will have more of Health Watch right after these words. We are back here on Health Watch. Operators are standing by right now, and they will be there well after we leave you at 9 o'clock. And the number is 856-489-0505. That also is the number you can call Innovative Medical during the week, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And their website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, we have what we call affectionately the Sleeper Special. Our show is aired this afternoon from 4 until 5. It's a repeat of this morning show. But some people say they like the 4 o'clock because they can sleep. I mean, what can I say? We can't sleep, but they can sleep.
Actually, you know what? One of my patients told me that she just tuned into the 4 o'clock show while we were off. And she said, guess what? It was the show where she called in right before we left for the break.
Yeah.
So it was cool.
So we're here at 4 this afternoon with a repeat of this morning's show. So check that out as well. 855-839-1210 is our number here. We still have time for a couple of calls if you want to jump in here and talk to Dr. Molly. 855-839-1210. Picking up our discussion of peptides.
Sure.
Didn't the FCC, not the FCC, the FDC,
right,
didn't they try to not allow peptides?
They did for a long time. But then, as I said earlier, what happened is there's a brand new weight drug that came out, right? And also drugs, they started to develop these peptides, and these are made in the lab, of course. They developed these peptides for certain conditions, like autoimmune conditions. They were using it in cancer research, like I said. And what happened is they definitely approved drugs for weight loss using the peptides. And as a result, the peptides have skyrocketed in price. But nonetheless, once they were able to get a pharmaceutical approval for them, now it's, hands off anybody else who wants to use them. But it's interesting because peptides have been used, the growth peptides, as I said, when we're doing regenerative medicine. You and I know that we've used that all along with our particular protocols. They're good for autoimmune diseases, metabolic diseases like insulin and this kind of thing for diabetics. And of course, they've been used for skincare and skincare lines all along. But right now, and cancer treatments too, but the exciting thing is the weight loss. As you know, it's called semaglutide, but they have a drug that the semaglutide was made from, and they call that Wegovy. Now, Dr. Molly has been on semaglutide for the past probably 5 months. Yeah. And I'm not the food police, guys, as you know. Now, if you want the food police, you got to talk to Barbara.
Oh, yeah.
And believe me, she was on me for a long time. And, one of the things as I got a little older and also looking at cancer history, this kind of thing, a little bit of too many fat cells in certain areas is very bad because it helps promote the cancer cells. So you got to really be on top of this. But the semaglutide, I'm using it and I dropped 34 pounds. I think I started out in the 180s. I'm not going to, and I don't give away people's weight or age, but I'm talking about myself now. And I'm now down to about 142 and a half, maybe 143. And I really want to get down to a solid 138 to 140. That's where I want to be in order to feel my best and whatever. And John, you made a funny comment when I sat down. You said, did I get my suits tailored yet?
Well, I noticed your suits were baggy.
Yes.
So that's how I knew you lost weight.
Well, it's hard to tell on somebody like me because God's endowed me with other attributes. So the point is, we've really got to, one of the things I want to say is that we're using this semaglutide in a weight loss program. We believe our program is better than just going in, getting the prescription for the Wegovy. The peptide is expensive in and of itself, but it's important. It's really important to follow that patient week to week the way I did for myself. Not only do I want to look at weight loss, but I want to look at body composition and things like this and make sure we're on the right track. And I want to look at nutritional status, because what happens is the peptide works on your gastric emptying, and it also works on insulin regulation. So sometimes what happens is we can have a situation where we're not in an ideal nutritional status after we start this. And I want to make sure for my patients that we stay that way. So this is a wonderful program. Not everybody qualifies for this. I want to say that right up front. That's another reason why you shouldn't walk in and just get it. There's a bunch of stuff on the website.
What would you have to do to qualify?
Well, I want to do some blood work. I want to make sure that we have good liver enzymes and certain other things that we have to look at. Your hemoglobin A1C, things like that. And again, not everybody should just walk in. There's these new things out that I'm seeing on the internet. $99 and you get to talk to the doctor for this, get a prescription for this weight loss drug. Guess what? That's not so good, folks. And you leave with the prescription on the telemedicine thing. Guess what? I'm a little hesitant about that. I think it's really important to have some blood work drawn. I think it's important to talk about how to take this correctly, and possibly to come in every week and let us, give you a shot, an additional shot in addition to the peptide.
So you get a shot every
once
week,
a week,
and
of the
then
peptide.
then you follow.
You follow us. You don't actually. They say you don't have to follow a diet. That may be true. But again, I would want to look at the nutritional status of the patient when they start and what they're eating week to week. That's important, because I want to make sure you're not getting anemic, that you're not having other problems, and I want to make sure that your liver functions are good, that we look at your pancreatic functions. There's a lot. You just don't throw this kind of thing at the wall and say, oh yeah, come on in and get a prescription for $99, guys. That's all I'm saying.
Will you tell us how you lost your skirt?
Oh, yeah, sure. I was actually in an exam with my medical director. We were talking to a patient, and my skirt came down. However, folks, I had my long white coat on that says Dr. Molly, Ph.D., and I'm standing next to the good medical director, and we busted out laughing because my lovely Linda said, oh, my God, Molly, look at this. Your skirt fell down. I said, oh, my God, Linda. I was so involved with talking to the patient. The patient laughed. It was a great thing, and that's when I knew it was working.
Yes.
So, what I want to say is I want people to have the energy while they're going through this. I want to do it safely, and we want to be involved nutritionally with our patient.
Would you explain just briefly, if you can?
Sure.
What are peptides?
Again, they are smaller proteins that are linked together in chains, very similar to amino acids that we use. But they are much smaller in nature. Their chains are smaller. So they're used as cofactors in various things, in inducing other systems to work. That's what they do. They can induce other systems. For example, for years they were looking at peptides to stimulate hair follicles, and it does. It's a cofactor. They've used it in autoimmune diseases many, many times. Speaking to one of my patients who called in, Rich, we've used it in neurodegenerative because it's a cofactor for hormones in many cases. So they're cofactors. The idea is you really want to be able to have somebody who's knowledgeable in peptide science, and I believe that, honestly, biochemists and molecular biologists are the most knowledgeable. Many times, there's many a case where my doc says, hey, Molly, how did you think about this? And then I give him what I did the research on, and he goes, wow, he goes, this is something we don't necessarily come into every day. So he said, I never thought about peptides in that area. Many of the bodybuilders used them crazily.
Yes,
okay,
yes.
For many years.
Yeah.
And along with their steroids.
Yeah.
No, not a good idea. Use them safely.
this is the time of year where everybody wants to lose weight.
All right.
We know that.
That's why I talked about it.
Does anyone qualify for this, or does it? What are the qualifications?
I have to run the blood work. I need to make sure that their GI tract is in proper condition. I got to make sure that the liver enzymes are good. I've got to make sure kidney function is okay. There are many things that have to be done before we throw the peptides at you. That is why I'm mentioning this. Look, guys, there's a lot of places you can go, $99. God bless you. Make sure you get some blood work. I'm telling you.
Yes.
This is a little advice Dr. Molly's giving you, because you don't want to have a problem with your liver. You don't want to have a gallbladder problem. Believe me, you want to make sure that you qualify for the use of these peptides. And actually, I would say, whatever we do, whenever we're giving out medical hydration, we try to make sure that our patient qualifies. It's not enough to say to someone, here, get in the chair. That's my big bite about all of these things. You just don't put a patient in the chair and say, let's go. You want to make sure that the patient qualifies for hydration. You want to make sure that the patient qualifies for a particular protocol. You don't want to do anything. What happens if you have a patient who has a hidden diabetes, who doesn't know it? Maybe you start to give them something that reduces their blood sugar too low. These are the things you've got to think about. Metabolics on every level. And that's something I will tell you that my physicians and myself, we look at all the time.
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, you want to call Innovative Medical Associates, 856-489-0505. Make that appointment. Talk to Dr. Molly. Sit down with her and really find out more about how she can help you and any member of your family improve your overall quality of life. 856-489-0505 is the number, and innovativemedicalassociates.com is the website, innovativemedicalassociates.com. Don't forget, we have our Health Watch replay this afternoon from 4 until 5, so if you missed any of today's show, you can catch it all this afternoon at 4 o'clock. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, Catherine, and Lana, those are our nursing staff, Joanne, Dee, delightful Dee, I should say, fabulous Fran, and our nursing assistant, caring Kathy. I'm your host, John DeMasi. Thank you for listening. We will do it all over again next week. Have a safe, a happy, and a healthy week. Health Watch will be here again next Sunday, 8 till 9, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.